The inflammatory cascade typically involves 5 stages. 1, tissue injury or infection. 2, vasodilation and increased vascular permeability. 3, recruitment of immune cells to the site of injury or infection. 4, activation and elimination of pathogens by immune cells. And 5, resolution of inflammation and tissue repair. In the tissue injury or infection of stage 1, mast cells release histamines, causing vasodilation and increased vascular permeability. Platelet-derived growth factor initiates the cascade by activating platelets, macrophages, and endothelial cells in response to various stimuli such as tissue injury and growth factors. In the recruitment of immune cells to the site of injury or infection of stage 2, macrophage chemotaxis attracts macrophages to the site of injury or infection. Neutrophils, eosinophilic granulocytes, B cells, and T cells are recruited to the site of injury or infection by cytokines, interleukins, a group of cytokines, and chemokines. In the activation and elimination of pathogens by immune cells of stage 3, B cells produce antibodies, IgA, IgE, IgG, to tag pathogens for destruction. T helper cells activate other immune cells such as B cells and macrophages. Killer T cells eliminate infected cells and tumor cells. Macrophages engulf and digest pathogens and produce nitric oxide and cytokines to further stimulate the immune response. COX-2 produces prostaglandins that contribute to the inflammatory response. In the resolution of inflammation and tissue repair of stage 4, anti-inflammatory cytokines and lipid mediators are produced to counterbalance the inflammatory response. The immune response gradually decreases and the damaged tissue is repaired. But in cases of chronic inflammation, the inflammatory response may persist if imbalance is not addressed, causing further damage. The 5th stage of inflammation is cellular proliferation and tissue repair. New cells are produced to replace damaged or dead cells, aiding the healing process. Fibroblasts produce new collagen fibers to strengthen the tissue, while endothelial cells form new blood vessels to deliver nutrients and oxygen. This stage is crucial for restoring tissue to its healthy state after injury or infection during the inflammatory cascade. Please note, some of the substances listed above that we've talked about can be involved in multiple stages of the inflammatory cascade, depending on their specific function and mechanism of action.